Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hello, my name is Shirley Merritt, and I'd like to welcome you to my show. I call it Raspberry Lemonade. Let's talk. First of all, I want to thank God for blessing me by bringing me to this forum. I also want to thank the staff of MS&Me Radio Network for giving me this opportunity once again. Today I want to speak to you about MS and what your new diagnosis means. I'm sure by now you've done some research on your own and hopefully you've learned some history about multiple sclerosis. You now know that the name multiple sclerosis means many scars. This is referring to the hardened plaques of scar tissue throughout the central nervous system. The nerve fibers in the CNS are covered with what's called a myelin sheath. We're all familiar with that term now. This myelin is like insulation, kind of like how there's insulation around electrical wires. Well, when the nerves are insulated, the signal transmission goes evenly and quickly, and that culprit, which is the plaques of inflammation, damage the myelin around the nerves. This interrupts the transmission of signals which go to the different parts of our body. For example, like if a patient has trouble walking, they probably have plaques of inflammation in the brain going to the legs. When we experience symptoms such as numbness in our limbs or weakness in our legs, or maybe a blurred vision in one of our eyes, it might be because we have plaque that has developed or emerged. However, sometimes plaques develop and they heal without causing any symptoms or problems. These episodes of symptoms are called attacks. Some people call them relapses or exacerbations, and that's if they last more than 24 hours. And your neurologist might decide to treat them with steroids. That calms the symptoms down. However, if they don't hang around for more than 24 hours and they disappear just as suddenly as they came on, then they're what is known as a pseudo-relapse. In other words, it's a fake or a phony. This is an instance when you'll gladly welcome a counterfeit. Oh, and there's no treatment necessary for a pseudo-relapse. For me, when I was newly diagnosed, the first thing I wanted to do was read and research, because all I wanted to do was find out everything I could about this disease. I wanted to be as well informed as I could. I needed to know everything. Since I was going to have to live with this, I felt like I had to be well informed if I was going to fight this thing called MS. I had heard of it, of course, but I didn't know anything about it. I didn't personally know anyone who had it. You know, I knew a couple of celebrities that had it. Some of them it was invisible to us, and some of them, you know, had really progressive forms of it. But I didn't really know what it meant for me. And I just knew I wanted to be able to be well informed and know everything I could about it. I think that's probably the very first thing that a newly diagnosed person needs to know is, you know, they need to know everything they can. They need to gather all of the information that they can about this disease. Now, not right away, but after a while, I started visiting different support groups. And I eventually picked one out that I wanted to join. Each member contributed valuable information, and it was a nice thing to be a part of an organization where we all had this thing in common. I called it a thing because I wasn't really, you know, sure about what it was yet. And I would highly recommend that any newly diagnosed person become part of a support group. I wish I had done it right away, but I didn't. I did go through some really lonely times in the beginning after my diagnosis. And I think I really, I had a lot of friends who just kind of, you know, I guess they didn't know this was strange to them. They didn't know how to handle it. They kind of started distancing themselves from me. They didn't call as much. They didn't invite me to hang out with them anymore, and I felt really lonely. And you know, they would call periodically to check on me, but I think that if you seek out people who have this in common with you, such as the people in the support group, once I joined that support group, it was like a whole new world opened up for me. You know, because I started making friends with people who I had something, you know, in common with, and they started telling me about different activities that they became involved with, and different functions and events and things that they would go to that I could come to, and they would have gatherings at each other's homes periodically, cookouts, and you know, all of a sudden it was like I had a whole new world of friends. So I mean, that's probably one of the first things that I would tell someone who's newly diagnosed. Join the support group. And if you don't know where any support groups are, you can probably well, what I did was I called the National MS Society, the Multiple Sclerosis Society, and they actually emailed a list to me of support groups in my area. And I was able to pick and choose one that I wanted to go to. And I visited, like I said, a few until I found the one that I finally said, okay, I'll join this one. I probably went 10 years before I finally joined a support group. I would not recommend any new person do that. You know, I feel like I wasted so much time being lonely when I could have had friends. I would also recommend participating in some of the luncheon and dinner MS events. These are given by the pharmaceutical companies. A neurologist or a nurse practitioner comes out, and they basically endorse the medication or the drug that is that they're going to speak about. They're endorsing it, and they come out and they give a presentation, and they start with general information on MS, and they have a question and answer forum. It's very informative because it gives people a chance to meet other people with the same illness again. We get to they present this very important information to us on general MS. We get to ask questions, we get to bounce ideas off of each other, and then they go into the drug that they are endorsing. And and the perk is that the restaurant serves you a really nice dinner while all of this is going on. And so it's a great way to gain knowledge. It's a very educational resource, and then again, you can also treat it as kind of like a social gathering if you want to. The meetings, like I said, are very informative, and they will give you the opportunity to be your own advocate. Say, for instance, on your next MS appointment with your neurologist, because you're going to be well informed. You're in a good position to have much more of an intelligent conversation with your neurologist about things like, say, if you decided that you want to try a new DMT, which is disease modifying therapy, and you heard about it at this event through this presentation, you can go to your neurologist and bring it up to him or her, but you'll have some information. You'll kind of know, but instead of them just telling you about it, you'll be able to interact with them, engage in the conversation, because you will have some education on it. So you can be your own advocate. And I found out about so many things. Well, there were quite a few things that I brought back to my neurologist, and I let him know that I want to try this. I have really severe muscle spasticity in my right arm, and one of the things that I found out about was Botox. You can have it injected into your muscles, and it's supposed to help relax your arm. And so I was able to go back to my neurologist, and actually I talked to a nurse practitioner first. She was an RN, a registered nurse over the research department. And I asked her if she had ever heard of it, and she just happened to say, your neurologist happens to be one of the few people in Georgia who are certified to administer that Botox into the muscle. I said, you're kidding. And so she actually, went to him for me and told him I was interested in trying it. And he actually, administered the Botox to my arm muscles. And, but I never would have known about it if I had not, gone to one of these events and felt educated enough to go back and talk to him about it. So, I would just really encourage newly diagnosed people to surround yourself with others with multiple sclerosis. To be active in the community. We call it our MS community. Some people refer to it as MSers, but surround yourself with people who have the same illness. I'm not saying all of your friends have to have MS, but if you surround yourself in the environment, you're going to learn more about it. You're going to feel more comfortable. You've been given this, and it's something that you're going to have for the rest of your life, and you just may as well know as much as you can about it. So put yourself in the environment to learn as much as you can. Um, the cause of MS is unknown. There are many theories. However, scientists are uncertain about the answer. They really don't know. There are some risk factors, which include genetic, environmental, even viral. Certain viruses and bacteria have been called triggers of MS. There are certain viruses, and I'm not going to go into them, but they actually cause flare-ups. That's what scientists think. So, like I said, the cause is unknown, but I do feel confident in feeling like and saying that they are researching this. They are actively researching this for us, trying to help us to find not only a cure, but they're trying to help us find a way to reverse the damage. So for the people who are newly diagnosed, I want you to feel good about, I'm making a statement now that I really do feel like they're really actively and aggressively trying to help us here, trying to help find a cure, and trying to help find a way to make things better for us. Probably one of the most important things that you can do when you're newly diagnosed is to be knowledgeable, like I said, but be knowledgeable about treatments. Treatment is going to be a key factor in managing this disease. Your neurologist is going to advise you on how important it is. It's crucial. It is so crucial. I cannot stress enough how important it is. It's a key factor in managing your disease, starting your treatment right away. Because the sooner you're on treatment, the less of a chance you'll have to have more relapses, which can cause disability. I've heard of so many people, and I've actually heard of people who they were diagnosed like 25 and 30 years ago, and they're not on treatment, but they're fine. They're doing really well. But MS is different for everyone. It's different for everyone. And it's like there are no two people that will have the same exact symptoms. If you have a room full of people with MS, sure, there are going to be some people in the room that have the same symptoms, but not exactly all of the same. They may have a couple of shared, symptoms. Like somebody may say, well, yeah, I have a weak leg, and somebody else may say, I do too. But no one's going to have the same identical symptoms. No two people will. And, I tell you, everybody's course is different. Everyone's course is different. There's no way for the neurologist to predict it. There's no test that you can take to predict what course your MS is going to take. So it's so important to just become as knowledgeable as you can and get on treatment right away. And you can stay well informed about resources and everything by joining. You can reach out to these organizations like the National MS Society, the MS Foundation. There's one called the MS Association of America. You can reach out to these organizations to find out resources. You can find out ways in which you can get involved. Things like biking MS for a cause, walk MS for a cause. You can become ambassadors through the MS Society. You can, there are just so many things you can find out if you're in need of things. They can help you with resources. If you become a member, you'll be so well informed about your resources, and you'll have access to the most up-to-date information and research. So I cannot tell you, I have been involved with these programs for so long, and gosh, I was diagnosed 16 years ago, and I know I've called probably each one of these organizations for at least 5 times each for some reason or another. You know, it could be just to find out where they're having some presentations in my area. It could be that I'm looking for resources about, you know, how to get involved in certain programs. It could be that I need information. It could be that I want to know about research. I mean, just all kinds of things. There are just so many things that they can help you with. Let's see. One of the things that I think is so important. You know, when you get diagnosed with MS, the first thing I hear so many people say is, "Oh, get some rest, get some sleep, sit down, relax. You don't need to be so active. You're too active. You probably need to rest more." But to be honest with you, unless you feel tired and fatigued, you don't have to rest and relax all the time. It's important to remain active and happy. Live as normal of a life as you possibly can, but be mindful of your limitations. Just remember, just because we have MS does not mean we always have to rest and relax. I think it's important to keep your mind happy and your body active. That's what keeps you the healthiest. Know your limitations. Know when you need to rest and relax and sit down for a minute. But you don't have to do that all the time if you don't feel it. I don't even take naps. I'll be honest with you. I never take naps. I might take a nap twice a year. I find that I'm happiest when I'm busy doing something. And then every once in a while, I'll just need a little power nap. And when that happens, I will sit down or lie down and I'll address that. I have friends that have fatigue and they have to sleep a lot. They sleep all the time. I joke and tease them about it, and I'm like, you're gonna sleep your life away, but you know everybody knows their own body, and they recognize when they have fatigue and they need to. Some people need to sleep. Everyone's MS is different. Another important thing to remember when you're newly diagnosed is about exercise. A lot of people think that people with MS should not exercise. They think they'll hurt themselves. That is not true. Exercise is so important to keep our muscles moving. You have to use modification sometimes. Fatigue management is very important. Everyone cannot do the same exercises nor at the same pace. I have problems with my core strength, so I cannot do a lot of floor exercises. And I miss that because I used to love to do crunches and things. But exercise should be something you enjoy and something that you'll be doing for a lifetime. Also, you've got to learn to manage the stress in your life. Everyone has it. It's inevitable. It's inevitable. You're going to have it at some point. The important thing to know is how you manage it. That helps. That matters. Everyone else deals with it differently. No one deals with it the same. Some deal with it poorly, and let it take over their lives or let it depress them. Others know how to quickly get over it or eliminate it. What's important is that you manage it, or it will affect your health. Well, I think that's about it. And we're going to end the show. We're running out of time, people. But I'm so glad that you joined me. And I hope you'll come back and listen to me talk again next week. Have a wonderful week. And just please come back and see me next time. Take care. God bless you.